Okay, so the PA student or medical student or nurse practitioner student mindset is if you don't learn every single thing, 100% of what they're trying to teach you, then you are either going to kill a patient one day or you're going to fail your boards, or in some way, shape, or form, something bad will happen or something good will not happen. Whew, take a breath, guys. Okay, take a breath. Yes, every single thing you're learning is tremendously important. Yes, every single thing that you're learning may potentially save somebody's life. Yes, most of what you're learning is going to be on the boards and you're going to need to know it in order to pass the boards. No, you do not have to know 100% of every single thing in order to pass your boards and to work as a medical provider. That is too much pressure. Too much pressure, okay? I had a professor in PA school who said everything's important, learn everything, but that is physically impossible. Okay, a little tiny bit more context because that was the 1 minute clip. Now the 2 minute clip is going to be, okay, this person is saying, the question here is saying, am I doing too much trying to learn everything, memorize everything during prerequisites? So this person's not even in PA or medical school. They're still getting their prerequisites. They're an undergrad, right? So this person's saying, I'm doing too much trying to memorize everything in prerequisites, or can I work hard enough to get good grades and expect PA school to teach me everything I need to know? So yeah, it's kind of the second one, guys. It really is the second one, okay? Your job as a student is to get good grades. Your job as a student is to get good grades. Your job as a student is to get good grades, okay? Your job when you're in school is to learn what you need to know in order to either at least pass or preferably get good grades. When you're in PA or medical school, your job is to pass. When you're in undergrad trying to get into PA or medical school, your job is to do super duper well, okay? You gotta get the grades. As a byproduct, you will learn quite a bit. Okay, now in medical school, it's a little different because you're competing with your classmates for residency spots and whatnot. So yeah, grades, the percentage you're standing in the class actually does count. In PA, it couldn't matter less, unless you're really trying to go for a residency, in which case it still doesn't really matter all that much compared to med school. Now, all that being said, yeah, you do have to do well enough to pass the program, okay? So there's that. In undergrad, it's a little different because you're kind of being weeded out, you're competing, so it's a little different. But again, your job as a student is to be a student, not to be a provider, okay? When you're a provider, especially when you're in clinicals and you're training, they are going to teach you the main things that you need to know. It's not 100% of every single piece of didactic material that's in your books, that's on your PowerPoint slides. Don't put so much pressure on yourself. As a student, just be a student. The training, I guess what I could say is trust the process. Trust the training, okay? The training will get you where you need to go. So right now, as a undergrad especially, but even as like a first year or second year student in PA or medical school, no one is expecting you to go freaking do surgery or go treat somebody or go run, a clinic with 30, 40, 50 people a day that you got to see, okay? Nobody's expecting that. That's not where you are in your training. Trust the process, trust the training, okay? Right now, you are doing as much as you can to get as much possible medical knowledge into your head, theoretically. Then you're going to put that into practice. You're going to put that into practice during clinical year or years. And then during your first job as a PA or during your residency as a PA or during your residency as an MD or DO, that's when the rubber really meets the road and they ramp up that responsibility, your actual responsibility for the lives of patients. That's when that is systematically, gradually ramped up in a safe way, okay? So again, your job right now is to be a student. After that, just trust the process and you will get where you need to go. Don't put so much pressure on yourself. Just be a student for now.